still a process that needs to happen before we can actually start giving kids this dose. It's exciting news, though. We definitely need this approval. We're seeing another grim milestone. Unfortunately, we surpassed another milestone of deaths in the United States. More than 675,000 Americans have died. This is more than the death toll we saw in 1918 flu pandemic. So we're excited about this vaccine for kids, but again, we're going to need parents to be willing to give their kids this vaccine. The FDA still has to approve it. There still has to be data that needs to be sent from Pfizer to the FDA to review it. And then they go through this application process, and it may take a month or two to happen. But we're hoping by the end of October, we should get the thumbs up to give kids this lower dose of the vaccine.
Hey, Dr. Chi, what about Pfizer? They say there were no instances of heart inflammation in their trials, but could there be side effects? Because as you mentioned, some parents are going to stay hesitant and look to see what happens when the vaccine is rolled out to the first group, ages 5 to 11.
So usually when you're speaking of that inflammation of the heart, we do see that it happens. It's very rare, but we are seeing that in mainly adolescents, and they're mostly males. And so this is gives some parents some hesitancy when it comes to the vaccine. When it comes to the kids, 5 to 11 years old, that wasn't really shown. They did have a robust immune response, so something that is healthy that showed that when you get this vaccine, you are protected from the virus. And that's positive, and that's reassurance. So I can understand that parents are still, worried that there could be some side effects. But when the data comes out, it will show you proof that when the vaccine is given to these children, it's relatively safe and effective.
Dr. Chi, here's the thing, so the efficacy is good. It seems to be safe. We still have an issue here, though, right? Because only 54% of this nation, a little bit less, has been fully vaccinated. So the adults aren't getting vaccinated. How do we get them to get their children vaccinated if they are on the fence getting vaccinated themselves?
First things first, we need to educate the public of the safety and get rid of this misinformation. There's so much rumors that are going around about the vaccine that still gives people this hesitancy to even get the vaccine. If the parents aren't getting vaccinated, there's no way our kids are going to get vaccinated. And that becomes a problem. Kids are in school, they're being, with each other, with other kids, and they're transmissible, giving these kids the virus themselves, and it's becoming a problem. We have to find a way to stop the spread of the virus. And that is the key right now. And our goal is to educate the parents, educate America that the vaccine is safe. We are still in a pandemic. People are still dying. Since the pandemic began and since we had the vaccine available, we still see over 100,000 people dying in the last few months. And that's unacceptable. So we have to do a better job as a country to get people vaccinated. And that way we can get our kids and teens vaccinated.
Yeah, unacceptable. It's just so unnecessary. These people didn't have to die, Dr. Chi, as you know. So we know the vaccine is safe. We know that, right? What about the protection level? Is it the same for kids and adults?
So we'll see that with the data that's coming out. Everything is preliminary. We're not sure exactly all the facts and all the data, but once those get released, we'll be able to know how much it is protecting against the virus and how it's safe. We already know that the virus is not as prevalent amongst kids, but the rise in cases because of this variant and the way it's changing, it becomes pertinent that we make sure this vaccine is safe and effective.
I have to ask you a question about the booster shot, right? Because it came out and they unexpectedly they said is for right now that people who are over 65 are the only ones that are going to be eligible to get the booster shot. What's to stop somebody from actually just going out there and getting a third shot and just doing it because they feel like it's available to them? Really, if you go, and I'm not encouraging anybody to do this, Dr. Chi, but if you go to a CVS or a Walgreens, you can tell them that this is your first shot, and more than likely you can get it because there isn't anything that's basically saying that this is your third shot. So what do you say to people who may be trying to go out there to get that extra booster, even though the FDA and the CDC and everybody else and all the authorities are saying that you don't need that booster shot or you shouldn't get that booster shot right now?
We're already seeing people getting the extra booster shot as of now. You know, the Biden administration kind of got ahead of themselves and made it be, you know, seeing that everyone should get it. It's needed for everyone to get the booster shot 8 months after their initial shot. And a lot of people went to go get the booster shot already, even though it wasn't recommended yet. And so nothing's really stopping people, but I encourage them to wait and wait for the real data and wait for FDA to make their approval and the real recommendations to get this shot. Right now, they're saying 65 and older and those with severe illnesses. Those are the ones that should get it. And I agree. If you already had your 2 doses, you should be okay, especially in the younger group. You should just wait. And getting that 3rd booster shot may not be safe. You never know what's going to happen. So what we really need to focus on right now is the unvaccinated, those group of people that have not gotten the 1st dose. Those who do have the shot, go encourage your neighbor, encourage your family members to get that vaccine because the hospitals are still full. We're still seeing people in the ICU. We're still seeing people intubated, and this is still a crisis. So those who want the booster shot, go tell your neighbor to get their 1st shot.